My fellow old rollers, welcome to the podcast. Dr. Ron Pavkovic, Jiu-jitsu white belt, and one of my training partners. And I say white belt because I want to pick on him a little bit. I call him Uncle Ronnie.
He calls me daddy, actually.
I do not call him under no circumstances. It's just like, what was that stupid movie, the Frankenstein? Like, no matter what you hear, do not open that door. Do not. But Ron, welcome to the show. So glad to have you on a show where we talk just with you on the stuff that you're into and up to. Because the previous show where we were talking to Chris Martin, that was more we were exploring his side of things. So want to get your take on some stuff too. So welcome to the show. Excited to have you, buddy.
Pleasure's all mine.
So let's talk a little bit. Before we get started in, kind of what our agenda for today is, there's a little bit that I wanted to get to know from you. You had like some pretty big changes in your life going from being a police officer to then just going back to school and getting a PhD in physical therapy. What is that, decision like? Because a lot of people, when they get a job, with the police department, that's a retirement gig. Like you're going to do that and stay with it. It's not a bad place to be. So what spurred the decision making to move from that to physical therapy?
Interesting question. I think I was a state trooper in Kentucky for right about 4 years, from the academy till when I left. And I think having a lot of friends who are police officers or were police officers, retired police officers, if you ask them and they're honest with you, there's a given point, probably multiple times in their career, that they said, fuck this, I'm leaving. It's the job. Every police officer, for the most part, I think, and all of us are alphas, at least have the alpha mentality. And I don't think if you don't have that to at least some degree, then you're not going to last. It's not why I didn't last, but the job itself was one of the best jobs I've had. But there's a lot of politics involved, especially at the state police level, but same in the city and county and sheriff's departments. And, I was on right about 4 years, and I think I was making $31,000 a year. And, because of the politics involved, there's a lot of supervisors and higher up in the chain of command that I believe, and again, I think most people would agree, that they kind of forget what it's like to be on the road. They forget what it's like to, make no money to put your life on the line. And I saw some of those politics firsthand. And I just thought to myself, 20 years of this, dealing with this kind of bullshit, is it really where I see myself long term? Because I love the job, and I'd be retired now had I stayed with it.
Yeah.
But the politics involved were just, to me, it was just too much BS. And, I knew I wanted to do something more with my life. And most of my life, I knew I was probably going to do something in medicine. That's kind of where I was always geared. So, through a turn of events, I left, and I left kind of like you see in a movie. It was the proverbial go fuck yourself, jack the round out of the chamber and hit your, post commander and set it down, said, all right, I'm out of here. And I didn't look back. So at that point in time, I was bartending when I left the state police, and it was kind of a slash bartend bouncer role because I just left the state police, and that was a bit of a hard transition. So usually I was the one called for handling most of the situations when they got a little bit out of control. And that ties into the whole jiu-jitsu game down the road, hindsight being 2020. But I was just at that point where I got to figure out what I'm doing. I'm almost, 30 years old.
Yeah,
Can't
real
bartend
grandfather.
forever. Well, I mean, I literally left a career and then I'm bartending. I was seeing people that I went to undergrad with and serving them drinks. I'm like, what a douche I am. So I applied to PT school because that was kind of my first interest, and I got in super quick. I mean, I got in like within 3 months, and that's just kind of unheard of. And I think a lot of it's because I had a career, I was older, and the PT program I went to, Bellarmine in Louisville, Kentucky, I interviewed well with them, and it was just kind of boom, 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 and there I was. So, I think my course in life was a bit predetermined based on my viewpoints, and I think God had a better plan for me, and that kind of ended with my doctorate in PT, and then so here we are, and then at the ripe old age of 44, I took up jiu-jitsu, and I think pretty much probably became the oldest roller in our class. I think
Maybe.
So. In our group, at least, in our class.
Possibly. Certainly look the oldest.
I look the oldest, and I probably feel the oldest.
You smell the oldest, too.
And I smell the oldest, and I have the injuries to say that I'm the oldest. And that's before I even got started. So, but as a quick
let's talk about that. What was the impetus, to start at 44? Because I'm not saying that's old. Like, to me, 44 is kind of like right around the corner for me, and I still feel fairly athletic. But I don't necessarily hear a whole lot of people making that decision at that age. What drove the decision to say? Because I know from your practice and like working with you that you've had to make some changes in your practice to carve out the time to come train with us. So, not only was this what some would say a difficult athletic decision, but you had to make, some accommodations within your business to make it work. So what drove that decision?
Well, so I did a tiny bit of jiu-jitsu years ago, and have always had an interest. Um, and it's funny. I think there's two, maybe three driving forces that really got me into jiu-jitsu. Number one is, I've worked out all my life and kind of had the bodybuilding, not really powerlifting, so to speak, but just heavy lifting, big guy mentality. And I was at a really stagnant point in my workout career. I mean, I've worked out and I've trained so much that just going to the gym was painful to me. I was like, I'm so fucking bored with lifting and pull-ups and everything else. And so I was only working out about twice a week. And so, as you know, I have twins that just turned 7, and my triplets will be 6 in September. So I have young kids for 45 now. And I'm thinking about them as they're getting older. I have 3 boys, 2 girls. I want, number one, to be able to enjoy my life a little bit better, be a little bit healthier, a little more energy, a little bit stronger. And I just, with the chaos of owning a business and 5 toddlers and no real drive to work out, I was kind of at that, not by any means a midlife crisis, but I was just at that point where I'm like, you know what? When I think about it, if I have to, and I say this tongue in cheek, but if I have to go down and like beat the kid's coach's ass because he's being a dick to him on the side of the baseball field, am I going to be able to do that? And I think anybody who gets into any martial art or jiu-jitsu or whatever it is, they always have that little thing in the back of their minds. And I joke about it. And I think there's a degree of seriousness to all of that. But my wife and I looked at a local place in town, place where we used to train years ago, and it wasn't quite what it is now. We both walked in there, and it was kind of the proverbial walk in. Nobody acknowledges you. Nobody's at the desk. You walk in, you look around, you're like, and then the medical side of me kicks in. I'm like, oh shit, there's blood all over the place. I don't want to get tested. I don't want to be training here and then come home to my wife and end up having crabs or something and have to explain. Wait a minute, honey, I got it at the jiu-jitsu place, but she was there with me. We both laughed about it. So I looked into it, golly, probably 10 years ago. And I went into that school and it was just like, nah, you know, uh, this place ain't for me. um, so, again, that interest was building over time. And I happened to have two patients who trained with us. And this was right before, about a month or so before Christmas of last year. We just got to talking, and our buddy Brian had just started probably about 6 months before that. And Daniel, who's been a buddy of mine for years, has always talked about it. So I just decided, I guess it was January 2nd, because New Year's Day we were closed. All right, I'm going to go in, I'm going to meet everyone, and just give it a shot. And then that kind of led into the noon class, which led into, luckily, my wife and I own our business, so I could change my schedule. So I did. I carved out Tuesday, Wednesday, Thursdays at noon specifically for that class. If I worked for somebody else, I don't know if I could have done that. And that I have very well derailed kind of my jiu-jitsu career from that point on. So, and as you know, once you carve that time out, and we know it now with the COVID virus shutting everything down, that's really the most important part of my day, minus my family time, my wife time, my kids time. So yeah. That's kind of the journey leading up to my ass beatings, 4 days a week.
Right. Well, it's on the other side of that, you joined the class. Was that a year and a half ago?
Yeah, it was January 2nd of 19.
Yeah, so you're coming in, and I'm what I consider like soccer dad strong. I work out and I lift weights and stuff, but I'm not by any measurable, sort of strength metric a very strong person, especially I used to power lift, and like being a part of that community, like your opinion of what is strong just, it changes. And so when you came in, like by the composition of our class that we have a lot of big, strong people. It's a lot of first responders and a lot of people who are gym rats. And so you're kind of walking in this, like land of the giants. And when you came in, I was like, great, another one, that's just what I need.
That's how we feel every time somebody comes in anymore.
But just from, training with you in the beginning and kind of like the on-ramp program where, we introduce people to what the movements and stuff are, I could tell that you seemed to have a fairly intellectual approach. And so it didn't surprise me that you were a doctor, just because the way that you would communicate about stuff, like you're definitely someone who the way you look is not necessarily indicative of like the greater truth of who you are, because you kind of look like a big ass meathead, and then you're certainly more than that, which is, I guess that's a lesson in jiu-jitsu too. Like, don't trust what you see, because
yes. Yeah.
But one of the things that I have been a patient of yours with a couple of like tweaks and some injuries that I've had, and so I know that you have you're really good at building protocols that are doable and actionable to help someone work their way through whatever kind of physical problems, so long as it doesn't require surgery and whatnot. Because you basically, I wasn't at the point on one kind of rib tweak thing that I had where I was going to have to get off the mat, but it basically hurt every time that I rolled. And within a few weeks, I was pretty darn close to back to normal. And then within a few months, I didn't even know, it was like I hadn't had that injury anymore. So I kind of wanted to get your perspective as coming to jiu-jitsu from lifting like I did. Like, we're kind of rare birds in this sport, but it seems like everybody at our gym is like that.
Right.
What you saw when you were a caregiver before you joined like jiu-jitsu, like what were sort of jiu-jitsu injuries or what, maybe the studies say, and ways that we can, with our strength and conditioning, help to mitigate or, prehabilitate those things away. And then if we do get injured, what some of those common injuries, like ways that you build protocols, and you don't have to like lay out a program. It's just like what things you're considering, so that somebody, when they meet with their PT, they can have, a pretty strong idea of what's going to take place and make sense of it, and not just be going through the motions, but actually be an active participant, with it.
So, I actually ponder this quite a bit because I'm very much a do as I say, not as I do kind of a person. So
there's another PT that we interviewed recently who was saying that, yeah, strength and conditioning, very good, helps, not get injured, but I don't do that shit.
Right. It's funny. The day I started jiu-jitsu is the day I quit working out.
Okay.
But luckily, in the grand scheme of things, I've done it for so long. I've maintained a large majority of my strength. What I had and still lack quite often is cardio. And I think years of training myself the way I did, if you're looking at, excuse me, if you're looking at, the physiologic makeup of individuals, the old ways are your fast twitch muscles, your slow twitch muscles, and now there's more technical terms, slow oxidative, and so on and so forth. But for just a generalized educational purpose, you're made up with X amount of tissue fiber types, and that's just part of who you are. And through sport specific training or workout specific, take professional bikers like a Lance Armstrong. You know what I mean? They do the same thing over and over and over, and they can convert some of those conversion types of muscle fibers into their sport specific stuff. And I think, looking at myself, I've trained for power and strength with no cardio. And I think, golly, at almost, in mid 40s now, that's my muscle makeup. I've always wanted to have a muscle biopsy just to see specifically what it is, and I could probably call it without having it done. It's a big assumption, but so, I think, and some of this depends age-wise on where you are in the age continuum. So for those of us starting older, especially those of us who, if we had worked out previously, we are probably set from a muscle fiber type on how we're able to perform. For those of us who haven't worked out and are getting involved, well, your body's like a blank canvas, just waiting to be primed for whatever you want to do to it, which makes me very jealous. Because knowing what I know now versus knowing what I know then, I would have changed things up. Not a whole lot, but to some extent for this particular sport. Because like you mentioned already, jiu-jitsu is a game of giant killers. It's a game of chess. And except for the rare phenoms out there that are monstrous and have a ton of cardio, the rest of us are typically going to fall on one spectrum. Either we're big and strong, and we really have to be able to work within our means and recognize our weaknesses and our limitations, and work around those, or you're going to be small and going against a lot bigger guys and girls. So you have to be significantly more technical as your base. And as coach always tells us, your strength and size, from my case, should be an attribute. So the technique needs to be on point for the little guys, because they don't have the attributes that they can cheat with. So I think it's harder for somebody like me, because I have the attributes that I can cheat with, even though they get smoked left and right. And a lot of the guys that we roll with that are at my level, I'm able to use those attributes for which I get in trouble all the time by the coach, because it's that false sense of I can cheat here and I can cheat there. So looking at that information, I came into jiu-jitsu with a bunch of injuries right off the bat. Multiple rotator cuff biceps tears in my left shoulder, rotator cuff tears in my right shoulder, meniscal tears in my knees, back problems. So,
couple of face problems too.
A couple of face problems. Bring
the camera just a little closer.
Really good and strong at is below the waist. Hence five kids and 2 pregnancies. That's all I got to say.
Yeah, well,
my
I
wife
think
would
that
probably say that's a problem though, because
I think she's on performance enhancing drugs.
Yeah. I'm that drug. I'm her performance enhancer.
Yeah.
But no, but going in and looking at the injury aspect, and having treated, rollers before, and seeing the injuries they were occurring, kind of gave me a little bit of a pre-insight to before I got involved. So, having been in for a while and having, like all of us, get tendinitises and bursitis and ligament sprains. I mean, fingers hurting. That arthritic hand from over gripping. This is a sport that no matter what you do, no matter how you prime yourself, no matter how much you train or don't train, you're going to get injured. There ain't no ifs, ands, or buts about it. It's the nature of what we do. But I believe that there is degrees of those injuries, and I think a lot of those injuries, if they can be prevented, or if you do end up having them, the length of time to rehab them can be significantly shorter by doing the right things preemptively. So, I think a big missing component of the jiu-jitsu game, and you've already touched base on this, is working out. Is a good solid exercise program to complement your jiu-jitsu game. And having that gym time, doing compound movements and doing a lot of mobility work, I think is key, number one, to longevity in this sport. And again, I say that without doing it regularly. But I'm speaking from a professional hat versus a personal hat right now. And I just myself, as we're talking about it, got into starting some mobility stuff because I am stiff. I am achy. I'm a whole lot more stiff since we've not been rolling than when we are. So, and I see that going on in myself. But I think there are definite ways to complement your game, to improve the attributes to use once your technique is solid, while double dipping into the realm of preventative care to keep you on the match longer. And the ultimate game for us, for this old rollers group, is for us to be there long term. We don't want to get that big injury that, as a white belt or a blue belt or a purple belt, puts us out, gets us in surgery for, we're out 6 weeks, 8 weeks, 12 weeks, whatever it is. And then by that time, you're like, all right, I'm out of it. Am I really going to go back right now? And then life takes over, and next thing you know, you're a year down the road, and you're like, shit, how did I end up stopping?
You bring up something there that's an interesting point that I want to segue for just a second, because right after I started, I hurt myself outside of the gym. I was actually doing some painting, and I fell off a ladder and twisted my ankle. And I talked to our coach, and I was like, hey, I can't do jiu-jitsu, so what should I do? And his statement, the first thing you should do is just come to class. Like, I don't want you on the mat, but I want you to sit next to the mat and watch what we do, and keep the habit of coming, and keep the habit in your mind of watching what's going on and trying to learn. I don't want you working out. There's no reason to re-injure your ankle right now. But if you stop, it's much harder to come back than if you just never stopped. So just like what you said, when someone has an injury, that advice that I got is something that I have seen work for myself and for others. So if you do have an injury, don't stop coming to class. Don't participate. Watch, try to learn, and take notes, write down. Like watch people roll and think, that's my partner that always catches me this way. What does somebody else do with it? And see if you can't learn from that. But keeping that habit, it really makes it a lot harder to quit when you get hurt.
I agree 100%. It's a really good point. I have, from day one, having already rehabbed some players, the guys that really kind of talked me into going and checking out the class. That has been my mindset from day one, is if I end up with an injury that I cannot roll, that time's already carved out for me. Mm-hmm. I'm not going to do something else with that time. I will be in class sitting and watching. If I'm able to get in and if I can do a warm up, if I can do some light technique with somebody in my uninjured extremities, then 100%. I think. Are you there?
Yeah, I'm still here. You got me?
Yeah, I'm gonna walk up and grab my phone charger. That's what happens when you have a business phone. It just rings all damn day, and then your battery dies when you need it. So I think that is probably one of the best pieces of advice that you can give from the standpoint of not getting out of the habit. All right, I think I'm good here. And I say this from my own standpoint, if you get out of that habit for whatever reason, whatever life throws at you, the chances of you getting back into that habit can be astronomically affected. Mm-hmm. So I think it is ultra imperative at all costs. You keep that time carved out, you stay, because you'll pick up so much extra stuff just from watching the people around you. I mean, there's no way that you cannot pick something up by just going there and sitting for an hour and watching what's going on.
Oh, I can say once again from my own experience, at that time that I was injured, I had a partner who he would always get me with a certain pass. And I just was like, I couldn't beat it. There was just no way that I could stop it. And so I just watched other people roll with him and deal with that pass. And, I got some ideas. Then when I was able to get back on the mat, I drilled some of those things and kind of put them into my muscle memory. And while I wasn't able to completely stop the guy right after, I did have at least, a strong response. I made that pass harder to do, which was a win for me at the time, especially coming back from an injury and being a little bit, what's the word I'm looking for here? Rusty, and cardio down and all that. So learned a lot from that experience.
I think this conversation segues into a point that I want to make kind of about what we're talking about. When you have an injury like that, especially an injury that's going to keep you off the mats, if it's an acute tendonitis, if it's a bursitis, and if you see a good provider, especially a provider who rolls, who has any contact sport background,
and that's great advice too. Like when you choose a PT, like get to know them a little bit before you choose. Like don't get a desk jockey.
There are a lot of medical professionals out there in all aspects of medicine that, at least for our sport, I think need some education on what it is we actually do. I think a lot of PTs, and not of any fault of their own, tend to be a little more passive in their approach and not aggressive enough to challenge the body to heal. One of the first things you need to do is, if you have a legitimate injury and something that is bothering you enough that it's on your mind quite a bit, is you need to rest it, at least for a very short period. And that ties into that. Don't get out from going to mat time. Just go sit and watch. But if it's an ankle sprain, baby that ankle sprain for a couple of days. And the best thing you can do for a lot of the injuries that we're seeing on the mat that are not major injuries, like a biceps tear, rotator cuff tear, whatever, is a couple of days of downtime, and then to start gradually loading and progressing that tissue. Because if you look at the research, and there's a ton of studies out there that get into tendinopathies and tendinal healing properties. What we know now, which we didn't know, well, I think we knew it years ago, we probably just didn't pay enough attention to it, is that getting in and reloading that tissue gradually, progressively, because it's going to respond and the healing properties are going to kick in by loading the tissue. So, but finding a therapist, finding a chiropractor, finding a physician who actually has a good understanding of tendinal healing, of ligamentous sprain healing times, muscle healing time frames, ligament healing time frames is imperative for what we do, because a lot of providers, if you go to them, are going to be very, very non-aggressive, and that's going to do you a disservice. You need a provider who understands that I've got to start loading your tissue. I've got to start getting you back to sport-specific stuff or good, solid strengthening, because that's what's going to make the tendon heal. That's what's going to speed up your healing process. Not somebody who's going to say, oh, you need to ice it, you need to get off of it, we need to put you in a boot, or we need to put you in a sling, or we need to put you in a cast, or whatever the other stupid shit out there people do, because there's a bunch of ridiculous stuff. It needs to be, hey, I want you to take a day or two off, and then let's get in and start working on this and start progressing it and start loading it. Because there is a time frame of healing, and it can be improved with the proper provider who's well versed in the physiology of tissue healing, and especially somebody who knows what we want to get back to doing. Because having somebody who's in this type of environment, who's in this type of sport, or has background in it, knows the importance of us getting back to it. So you want somebody who appreciates that, is not just going to say, oh, well, maybe you just don't need to do that. Maybe you need to change the way you are, trying to do whatever technique, that's bothering you. And there are some injuries where you have to modify. And that's the cool thing about jiu-jitsu is, you learn the basics, but it is infinitely modifiable around your skill set or your injury set and what you can and can't do. Because there are certain things and there are certain positions that with my shoulders, it just ain't going to happen, because that will cause me an injury to the point where I'll need surgery. And I just don't have the ability to go through that. And that's the neat thing about it. So
yeah, there's still a jiu-jitsu for you. Just it's got to avoid that one spot.
Yeah, that's exactly right. And I've rehabbed several guys in our class, some of them have ongoing knee issues, and so they've legitimately changed their passing technique, their sweeps, and because their knee just can't tolerate, from a painful standpoint, what's going on in those particular positions, and we found ways to work around it, and that's the cool thing about it. But have you
heard of Roberto Gordo, I think, and I can't remember his last name. He's a Brazilian. I believe he's won a couple of world championships, but he kind of invented the half guard game. Previous to him, half guard was sort of seen as like a stalling position where you're just trying to keep someone from passing to hopefully not get scored on before the bell rang.
It's always a stalling position for me, man.
Well, Gordo, he had a really bad knee injury and couldn't play close guard because the positioning of his leg and holding his feet together and trying to hold someone in place was aggravating it. And so he had to start playing half guard, and because he was kind of stuck there, started trying to find offense and a lot of sweeps. And so it was the injury that caused that innovation, so to speak, which I always think is really fascinating.
Yeah, and that's the neat thing is when you have injuries, and especially if you have something that's a significant injury or even a minor injury that is nagging and recurrent, then you start to find ways that, hey, I can't do this, but what can I do? What can I do from this position that doesn't hurt me and that's still effective at letting me change positions or pass or retain. And that's what I love about it is you could be, have a significant amount of injury and still train safely and learn a whole new game if you have to, based around your limitations.
Something else that you said there reminded me of something that I studied and learned about in the powerlifting world. The lifters at Westside Barbell Club with Louis Simmons would, as part of their upper body or lower body workouts, would do a lot of high rep, very low weight, either bicep curls or hamstring curls. And reason being is that and also like tricep extensions. So, so maybe even leg extensions too, now that I think of it. So both directions, flexion and extension. But it was very low weight, like 5-pound ankle weights and 1 pound or 2 pound hand weights for like 500 reps. And what they were doing was they called it ligament work and tendon work. Was basically like shoring up through, like blood flow work and high repetition, the thickness and the strength of their ligaments and tendons to tolerate the, world record level loads that they were going to be in putting on. And I always thought that was fascinating because, here's people who are squatting, upwards of 1,000 pounds, and they end their workout with a 5-pound ankle weight doing hamstring curls.
Yeah.
And when you're talking about loading the joint to get the tendons and ligaments to start healing, that sounds to me like sort of what they're doing. It's just that they're doing it before an injury, maybe not after, hopefully.
What those guys and girls are doing is kind of the proverbial cool down, right? Because if you're looking at sports specific in particular, or just working out, jiu-jitsu, whatever, the proper way to not get an injury, or at least to diminish the risk of injury, is to have a good warm up. In our class, we do a short warm up, and it's not aggressive. It's something to get the blood flowing. It's something to get your body moving, to get the to get the juices flowing, to get your heart rate elevated, and that plays a big role in preparing you for the activity that you want to do. That same thing comes into the back end of that. If you go and you train like we do, where you drill for a half hour and then you roll, 5-minute rounds, and you just stop, we're wiped out at that point in time, right? Your heart rate's up, everything's elevated. And that cool down is important to cool your system back down. And that low load intensity training has a positive effect on tendinal, in particular, tendinal recovery properties. So, I think that's an essential aspect of any sport, but our sport in particular, is that proper warm up and having a little bit of a cool down period. As you were saying that, I was gonna comment on something else. I'm having a complete brain fart about what it was. Tendons in particular respond to load. The job of the tendon, if you think about it, which attaches the muscle to bone, the job of the tendon, besides just being there to connect muscle to bone, right? If you think about what the skeletal system is and the muscle system is, skeleton's your frame, muscles move you, the tendons attach the muscles to your frame, right? And they're the connection points. But they're also designed to tear before the muscles tear. Okay? So the tendons have these stretch organs inside of them, and their job is to sense lengthening contraction of the muscle tissue. If there is an excessive stretch placed on the muscle, then the tendon's job is to say, "Oh, hold on a minute, we got to stop this." And if it's too far extreme, then we're going to tear so the muscle doesn't tear, because a muscle tear injury would be worse than a tendinal injury. Because tendons tear. They tear all the time. And you can go the rest of your life without having to have a rotator cuff repair or Achilles repair, let's say, whatever it is, unless it was a full thickness ruptured, completely retracted type of an injury.
Sure.
So having that warm up, getting those blood, getting that blood flowing, getting those tendons and ligaments ready to accept the load you're going to put on them. Yeah. Sorry, Harrison.
That's all right. Yeah, for those on audio, Ron is responding to the boss.
Yeah. Have an emergency. I'm gonna walk with you.
All right.
So having that warm up and adaptation of the connective tissue to the load about to be imposed on it, and then allowing it to cool down afterwards is a key to help prevent injury and to manage it if there is a small injury going on. Hang on 1 second, buddy.
It's all right.
We gotta.
We're doing surgery right now.
We're doing freezer surgery. Got it? Okay.
Now, for my feather old rollers, what you just saw was a doctor being a dad and having some responsibilities. And that's a big part of this podcast is learning how to work with it, work around those and still maintain them.
Yeah, it's my whole life, man, working around a shitstorm of chaos. That was the freezer not closing. That's important stuff right there.
Yeah.
So, going back into the whole injury thing, Harrison, a good solid strengthening program. And there are a ton of programs out there specific to jiu-jitsu. I mean, guys and girls who are so far ahead of us in their game, right? Who have come out and done really good kettlebell workouts. I tell you, I'm a huge fan and used to do it and still do some CrossFit. I think CrossFit is an enormous complement to jiu-jitsu. Because the high intensity, low weight, cardiovascular aspect of what CrossFit brings to jiu-jitsu is, they go hand in hand together. However, what people need to also recognize, especially as we're getting older, we also need recovery time. And I think probably the most important thing that we do, above and beyond strengthening, above and beyond training and technique and all that, is recovery. And I think that's where most of us fail when it comes to injury prevention, is not taking that downtime. And I'm not saying you got to take a week or two off out of the gym. But having a day or two during the week where you don't do anything. You just do your normal stuff. That recovery time is an absolute. The other absolute to that is sleep. Sleep is an absolute key. Sleeping or insomnia, which I have, and I tell you that firsthand, wreaks havoc on your body's ability to repair itself. And if you're not getting the proper sleep at night, you're not feeding yourself properly, and you have a nagging injury, your recovery time is going to be a whole lot longer. So I think there's some key takeaways to this whole thing is, adding a strengthening program is great preventative. But any strengthening program, you have the risk of getting an injury. You work out long enough, you're going to tear something, you're going to sprain something, you're going to have, some chronic trauma to the tissue. And you combat that through good recovery time. You combat that through proper sleep and getting the right amount of sleep. Because look, as we get older, our old asses need more sleep. That's a fact. It's like when we're kids. But most of us don't get it. So that's kind of one of the hard parts is, there are some key takeaways here. It's just you've got to force yourself to make it happen in order to keep yourself rolling in the long term.
Something that you said there that it kind of reminded me directly of the podcast where we spoke with strength and conditioning coach Jim Laird. And he said that a lot of his work with athletes, and he's worked with professional athletes from the NHL, NFL, Major League Baseball, MMA fighters. A lot of his work with them is teaching them how to do what he calls working in, so that they then earn the right to work out. And what working in is building those recovery protocols. If you're going to get close to maxing out the body's recovery ability and you want maximum performance, then you have to work just as hard at recovery so that you have a higher tolerance to the training load. But if you're overloading the training stimulus because you're not recovering hard enough, quote unquote, then eventually you'll have a lapse in performance, or you will have an injury. Like, one of those two things is going to happen. And so a lot of what he does with athletes is actually toning them down for a time period so that the, like whatever hormonal processes and stuff like that are in play start to normalize. And then all of a sudden their recovery ability is stronger, and he can build them back up, to that higher level of training in a way that their body can tolerate, and they are not at an increased rate of injury, but also there's not a performance lapse either.
Yeah, absolutely. I agree with that 100%. Jim's really good at what he does. Jim's a local boy here in Lexington.
He's a Canuck.
Yes, he is.
He's also bald like us, so I appreciate that.
You've got a lot of bald guys on the Old Rollers podcast.
Yeah.
Hence the Old Rollers. I think some of them just want to be sexy because they know bald men are sexy.
My dad said that God only made a few perfect heads, and it would just be a shame not to show off his work. So that's what I'm going with.
As a quick side note, I don't know how much longer my phone's charging and still dying. That's crazy. There's another big push in doing mobility work, Harrison. Pre-mobility work, post-mobility work, so foam rolling and all these things. And there's a lot of misconceptions where, I'm stretching out my IT band, right? I'm foam rolling my IT band. And unfortunately, medicine has promoted this in a way with the wrong terminology. There's a big misconception that you can stretch ligamentous tissue like the IT band, right? And you can't do that stuff. It doesn't mean it's not painful when you roll it out, and it doesn't mean that it doesn't feel better when you get done. But if you really dive into the research on this, these types of things, which I'm a proponent for, but they've got to be done daily. If you're not doing them, my wife does it 3 times a day. I mean, she's now training in powerlifting. She was a big CrossFitter forever, former bodybuilder. I mean, she does mobilization and stretching, 3 times a day, every single day. Mm-hmm. That's probably why I don't do any of it, because I watch her so much. I'm just, I'm wore out by the time she gets done. But it makes a big difference for her, sport specific and what she's doing. But what the body is not experiencing is a stretch of tendons, a stretch of connective tissue. It's not releasing anything. It's not changing anything. However, there's a neurological response. It's an adaptation to pain. And I think jiu-jitsu, I know jiu-jitsu, neurologically speaking, fits very much into this realm. If you think about when you first start training or you first start learning a technique and it's something that you're limited in, and the longer you do it, the more you do it, the more you start to adapt to it, right? For instance, my knuckles and my great toe and my freaking lower legs, when I first started rolling, probably the first 6 months, I just felt like I wanted to cut them all off. They were miserable. But then you start adapting to it. Your nervous system starts to say, hey, this is painful, but it's not traumatic. Mm-hmm. It's nothing we need to change. So we're just not going to worry about the pain signals coming from these areas anymore. And you start to feel better. And your body starts to adapt to that new pain level, that new pain threshold. And that's what's going on from a mobility standpoint. A mobility standpoint is really good at easing tissue tension, but it's not doing anything long-term to change tissue structure. What really changes tissue structure to the point that it's going to be beneficial from a rehabilitative program or a prehabilitative program is strengthening and sport-specific training. So something to keep in mind for everyone who's like, oh, I got a foam roll and I got to do this and I got to do that. It's great. I'm just now getting back into it because I'm doing that during my time when I normally would be at class during the viral shutdown. Mm-hmm. And it's good. It makes you feel good. And it can take some of that post-training discomfort and soreness and stiffness away. But just remember, use it for what it is. And that's a short-term analgesic or short-term pain reliever that's not really changing any underlying tissue structure, but it can be a key in at least managing some of that injurious or post-training irritation that we all experience.
That's interesting to me. When I was powerlifting a lot, I would get this searing pain sometimes underneath my kneecap on one leg while squatting. I would be doing my warm-up sets, and I would just have to shut it down because it would be like a knife going into my knee. And so working with Jim at the time, Jim Laird, he said to foam roll both sides of the muscle tissue around my knee. So like my VMO, and then the whatever the tendon that comes right to the top of the patella. I think it's just a patellar, but I'm not a doctor, so I don't know the names of shit. And then the muscles around the bottom of the knee too. And I would do that during my warm-ups, and all of a sudden it would, like that pain would subside. And so it was almost like the pain was a ghost pain. There was no underlying problem. It was just that for some reason my nerves were just, getting tricked out over, doing some squats. And then once I would roll it, then for whatever reason they would say, okay, we're fine, let's do it,
Well, and that's what goes on neurologically, basically. And it's similar to other manual therapies, to spinal manipulation, to soft tissue work, to deep tissue work, massage or myofascial release. If I don't even like using that term because it's a bullshit term, but it's still propagated a lot in our profession and in medicine. But any of those hands-on techniques where anybody claims that they're changing that tissue structure prior to the exercise, they're not. What they're doing is getting some blood flow to the area. They're warming it up, and there is a neurological response in the nervous system through a couple different non-opioid based pathways at the spinal cord level, which helps to temporarily kind of disband or temporarily block the pain signals from going up to the central nervous system. And the spinal cord is a really neat thing because it can gate those pain signals. So if you think of the spine to the brain is like this neural highway, right? And there's a bunch of signals coming in from everywhere. It's going up into your brain, and your spinal cord is kind of the gatekeeper that says, yeah, we need to send this up. They need to check it upstairs. There's something more going on here. Or it can say, we got this down here. And that's kind of what we're looking at from those manual therapy or pressure type or even manipulative or adjusting type techniques, is a short-term neurological benefit of the body's own pain management system to then kind of take that irritation out of the way prior to whatever it is you're going to do.
Mm-hmm.
And that's what you would have experienced going on with that.
That makes sense to me. Like I said, I don't, have any idea what was going on. I only know that having been given that advice, and then I just had this crazy pain, like it was almost unbearable. And so it was enough that I would shut it down. And then going from having to just completely shut down to, okay, if I start to feel this in my warm-up sets, I just foam roll both sides, after each set. And then after 2 or 3 sets, it would be gone, and I could get into my heavy sets. And I say heavy as a relative term for anybody who follows powerlifting. I never, ever lifted heavy because I just never got strong enough to. I always wanted to, but it wasn't there. But what was heavy to me, I could get to those higher intensity sets without pain.
But then when you went to do it the next time, did you have to do it the next time?
Not every time. It seemed like it would just kind of come and go. Like it was just like almost at random. And that was another reason that I wasn't worried about it, because if it was an injury, I kind of felt like it would be happening every time, and I wouldn't be able to just get it to go away. Like if there was something really wrong, then my body's not going to let me just, get after it. It's going to say, hey, we gotta tone this down, bud.
Yeah. And I think the fact that you manage it, you're able to manage it. And I think that's a takeaway point, is managing it with those short-term interventions is a really good way to keep longevity in the sport. And that's why, it's an important thing to do. again, it's a short-term benefit, but it's something that's got to be, it's the whole use it or lose it thing. If you don't do it, then you're not going to get the benefit out of it. But if you want to get the benefit out of it, then you need to do it. And you need to do it regularly and consistently.
Yeah, and it took some experimenting too. I've had some stuff with my shoulders that, lacrosse balls have helped, during my warm-ups. And the same thing, just making that a part of the protocol. Like, the lifting is a part of it, but also, that mobilization and getting the pressure in there. Just it tones down, kind of like what you said, the neurological response. Because I never felt like there was anything injurious going on. It was just like all of a sudden these weird pains, and then I could get them to go away if I did what I did.
Yeah, absolutely.
Well, we're coming up on about an hour, and I don't want to keep you too much longer. I do want you to commit to coming back to the show because I've still got some more questions for you. But if any of my fellow old rollers wanted to get to know more about you or reach out to you, how would they look you up, Ron?
Man, they could text me. I don't answer random texts by any means, but if they just say, "Hey, I saw your podcast,"
you don't want a bunch of DPs.
Exactly.
You sure?
I don't want to have to explain anything to my wife. I like to keep everything on the up and up. Like how you get crabs from the last jiu-jitsu place you were at. But they can reach me on my cell phone, 859-619-5808. They could email me, ron@advantageptlex.com. Facebook, I think it's under
Uncle Ronnie,
the best doctor in the world. No, I think it's Dr. Ron Pavkovic, something along those lines. I'll be glad to respond anytime to anything. I mean, I teach all over the U.S. Manual therapy interventions to medical providers, and I have guys and girls that I taught years ago who still shoot a text to me every now and then. Hey, what do you think about this? Or hey, did you see this new research? So I'm always open for people to reach out.
Well, that's pretty darned awesome. I know that I've had the benefit of some of your wisdom there via text. But not any DPs.
No.
Yet.
No, maybe when we get back to class.
I really appreciate your time and your insight. I think you've handed down a lot of great information that my fellow old rollers can put to use, and it was really, really, really worthwhile getting to ask you these questions because I can already tell there's some elements of my training that I want to change up based on what you've given us.
I think one parting word of advice I would give, and this is how you are. And I think we've talked about this and Seals and I have talked a lot about it, is almost every one of us who get into jiu-jitsu at any given point in time have an alpha mentality. And especially the older guys who are bigger, who are stronger, but even those who are not. Be the nail. Everyone's afraid to be the nail. Everyone wants to be a hammer. You are exceptional about being the nail. And I mean that as a compliment. What I mean is you're a sponge. I mean, I learn as much from you as I learn from Seals, just in our roles together and in our conversations, because you have a gift of teaching and seeing things from an analytical standpoint, and I'm a very analytical individual, so I can relate to how you view stuff.
I felt that same, like your perspective seemed a lot like mine, and actually from our history, I don't ever want this podcast to be about me, but I can say we have one what I think was very instructive moment where I was working with, like, you and I were rolling, and I think I was in your half guard, and you were just like using like a lifter's Valsalva maneuver, like bracing your core and like, and I could just tell every time you wanted to do something, all I had to do was just like, just brace for a second, and then you do that powerful explosive motion, and then it would be over because you'd be gassed.
Yep.
And so coming from a lifting background myself, I used to do the same thing. And what I had learned for myself as a way to get over that was to talk to myself, so that if I'm talking, I have to breathe in a metered way. And so, yeah, I kind of annoyed some training partners because I was like talking under my breath and looking like a dork, but it helped me to end that muscle memory from lifting all those years, so that I could be, and I hate to use this word, but to use Kelly Starrett's word, more supple in my, in my motion. So when I sensed you doing that, I was able to pass that along, and then just within, a couple of weeks, your rolling changed like a lot, just because you were really picking things up and not trying to just aggro. You were trying to technique things because you were refusing to allow yourself that explosive answer. You were looking for a technical answer from that point on.
Absolutely. And I use that. So I do privates with, with our coach every Friday, and through our rolling times, it's talking and laughing, because I'm getting smoked, obviously. But it's the whole conversation thing that I picked up with you. But what your game has really progressed. I mean, I've been with you a year and a half. But there's no ego in you. And
that's not true. That's not true.
What I mean is, compared to me, compared to
Well,
a lot of the other guys in our class, right? So we have those bigger, stronger attributes, and not that you don't, but you just have the ability. And I think this is a good piece of advice for anybody who's out there: is everyone's going to be the hammer at any given point. Being the hammer, I don't think, is a hard thing. I think it's the easiest thing in jiu-jitsu. Being the nail is not. Being able to sit back and analytically look at what you're doing and what's happening, and walk out of a class and say, you know what, I was frustrated about this, but here's what I picked up. Here's what I saw. Here's what I understand about it. That's what I mean by being the nail. I think that's the best piece of advice I've ever been given, and I think that's the hardest piece of advice, because every one of us just wants to hammer the shit out of everything. I mean, that's one thing we love about the sport, is it's a hammering sport.
You get to almost fight. It's pretty cool.
That's right. And when I was a police officer, Harrison, I really had no stress in life because, well, I mean, I was single, I didn't have kids. So, I mean, there wasn't any, life stress. But if I was having a bad day, guaranteed I was getting in a fight that night with somebody. Not that I picked it. I just knew it was coming. And I was able to vent my frustrations in my job. And I look back on those days and I was relatively stress-free. I slept like a baby, had no stress. But when I became a civilian, I lost that ability to vent frustration. And that's one thing that I love about jiu-jitsu. It's a venting kind of a sport. But because of that, it's, we all know those people who just, no matter what, are not going to tap. They're just going to hammer. And I don't think you learn that way. I think, and this is what I'm gauging my game on now, is I think you learn by being the nail. You're going to have hammer time. If you have a career in jiu-jitsu, longevity, when we're rolling at 80 years old, 70 years old, you're going to have more than your share of hammer times. Hammer time. I'm not going to do the dance. All the old rollers will get hammer time. But being the nail, man, that's where the depth comes into play. That's where you pick it all up.
That's something that's been hard for me too. I don't try and pretend that I've had the easiest time with that, but something that I started doing initially, when someone would tap me or pass my guard or kick my ass, I would feel kind of down on myself and be like, you suck or whatever. And I kind of felt like, well, this is going to end this for me, because I can't take this emotional beating plus a physical beating. And so what I had to do was to take the pressure off myself. And instead of saying I suck, I would just say good job to the other person. So it wasn't that my jiu-jitsu lost. It was that their jiu-jitsu won. It was just a reframe. But if I get tapped, I made it where, or somebody passed my guard in a cool way, I would be upset, but I would try and short circuit that upsetness with good job. And because I like jiu-jitsu and their jiu-jitsu, even if it was like an athletic and not like what we consider like the most technical, if their jiu-jitsu with that attribute or whatever was better than mine, then jiu-jitsu won. And I like jiu-jitsu, so I have to be okay with that. And I have to say, good job. And then what initially was kind of hard, like it sucks still. After a few weeks, all of a sudden that just became the habit. Now, does that mean that I go into every roll thinking, yay, I'm going to get to tap? No, I do not. I want to win just like anybody else, but I'm okay with being the victim of jiu-jitsu because I think jiu-jitsu is beautiful. So if it happens that it was beautiful and it's beautiful on me, I don't love that, but I will say good job. And that sort of short circuits that sort of down feeling that I would have and made it a lot easier for me to go from, okay, I suck, to either A, what did I do wrong and what could I do better? Or B, what did they do right that I could emulate? Either one of those things could be a possible solution for me. So I'm going to be okay with that,
Yeah, no, I mean, good advice. I mean, it's, I agree 100%. And I've noticed that with you. And that's one of the takeaways that I've tried to employ, because of seeing your ability to do that. I think that's a good piece of wisdom.
It's just a short circuit because I have the same. I don't think I'm as alpha as you, so to speak. That's your language. I probably don't have that level of competitiveness, but I do have some level of it, and I don't like losing. I really don't. But if I could I will say that I have tried very hard to cultivate a sense of, is learning more important to me than winning? And if this is training, if I'm trying to just get better, then every opportunity to learn or get better is more valuable than an opportunity to win. And this actually a little bit comes from strength training too. I don't know if you've heard of a guy named Jim Wendler.
Mm-hmm.
Okay, so he wrote a book called 531. Myself and Michael talked about it. And one of the things that I got from that book was that there is building strength and there is demonstrating strength. So in your training cycle, you are building strength. Your job's not to max out. Your job is not to even know how strong you are. You're just trying to get stronger. You may not know what level of strength you actually have. And then if you're going to perform at a meet, your job then is to demonstrate strength. And when you go to a meet, you're not going to get any stronger at that meet. You're only going to demonstrate the strength that you have acquired. So if training is kind of like our training cycle from lifting, then my goal is to build strength, quote unquote, just to get better at jiu-jitsu. If I go to a competition, my job is to demonstrate. I'm not going to get a whole lot, like you will get better, from competition, but you ain't getting better that day, like you'll get better from the lessons learned. So just trying to take that nugget of learning from another realm and reapply it, because every lifter wants to go in and bench press their max every day, every single time. I do too. I'm one of us. But if you really buy into the idea of I'm training and I'm building strength, then you'll short circuit that desire in the name of getting actually stronger if you trust that this program is going to make you stronger.
Yeah, absolutely. I agree 100%. And that's going to help you from an injury standpoint too.
I think that, yeah, absolutely. Going back to 531, I was at my very healthiest when I was on programs like it, where I wasn't, like redlining it all the time. I was staying in that kind of like honey zone of like 65 to 80%. And I'm being challenged, but every rep that I do, I can shut it down before it gets imperfect. So I'm always practicing perfect reps. And they're tough reps, but they're not so tough that my technique is failing. And jiu-jitsu, I think, has a similar thing from the coaches that we've talked to, namely Lachlan Giles. Staying in that honey zone seems to accelerate skill acquisition, and ultimately the best jiu-jitsu person will win long term.
Yeah. Yep. Absolutely. Couldn't agree more.
Well, thanks for your time, Ron. This was an awesome talk, and like I said, I really got some great information from this, some good stuff that we can pass along to our old roller nation. That's going to help us all train and be on the mats longer and better.
Awesome stuff, man.
Have a great night, brother.
You too, buddy. Take care.